Hi, good evening. I am Professor Dr. Pradyut Waghray. I am a professor of pulmonary medicine and chairman of the Kunal Institute of Medical Specialties Private Limited in Hyderabad. My dear colleagues, today I wanted to emphasize the critical challenges which we face as clinicians towards sarcopenia, which is seen very commonly in COPD and in severe asthma patients. Sarcopenia treatment really poses a big challenge in the treatment of these two category of patients. As we know from our collective experience, I'm sure all of you must have seen this. Any chronic systemic inflammation, because it causes persistently elevated cytokines such as tumor necrosis factor alpha, or otherwise called as TNF alpha, and interleukin 6. Both these two drive the muscle protein catabolism, while factors like sustained hypoxia, reduced physical activity because of the respiratory distress, and also long-term use of corticosteroids further compound these effects. So then this multifactorial process underscores why most of these COPD patients, to the tune of almost 1 in 4 patients, they develop sarcopenia, which is a prevalence that markedly increases with disease severity. As the disease severity of COPD or chronic asthma increases, the incidence of sarcopenia also is seen more in these patients. The accurate diagnosis of sarcopenia predominantly relies on both number 1, imaging, and number 2, functional assessments. The MSRA, which stands for Mini Sarcopenia Risk Assessment, this parameter serves as an important screening tool, while assessments like hand grip dynamometry or gait speed analysis or the commonly used 6-minute walk test, all these evaluate the muscular functionality and techniques such as dual energy X-ray absorptiometry, otherwise called as DXA in simple terms, or even a CAT scans allow the precise measurement of the muscle mass. Now, beyond diagnosis, once we diagnose it also, the nutritional strategies are known to play a pivotal role in the management of these patients with sarcopenia and COPD. They say that supplementation with calcium beta hydroxy beta methyl butyrate, otherwise called as CAHMB, this supplementation is particularly of benefit because it has shown to attenuate the muscle protein breakdown and to stimulate the muscle protein synthesis. Not only it reduces muscle protein breakdown, but it also increases muscle protein synthesis, thereby preserving the muscle mass, which is very much reduced in these patients. So this is a very important component of the treatment. In addition to this CAHMB, vitamin D has been found to be essential for muscle function, because they say it not only supports the neuromuscular performance, but also vitamin D modulates the inflammatory responses, which is critical in these patients with chronic pulmonary conditions. We have seen how vitamin D played an important role during the COVID pandemic because of this modulation of inflammatory response. Magnesium is another player which acts as an important cofactor in numerous enzymatic reactions which are concerned with this energy metabolism and muscle contraction, making magnesium indispensable for maintaining muscle health and mitigating fatigue in these patients. Even in our clinical practice, many times when patient complains of fatigue, we give them magnesium and it significantly improves their condition. So in addition to the mitigating fatigue in these patients, it also maintains the muscle health. The integrating resistance and aerobic exercises with targeted nutritional supplementation. So combination of these two, integrated resistance and aerobic exercises with targeted nutritional supplementation, which includes, as discussed earlier, the CA-HMB, vitamin D and magnesium. This combination of both the diet as well as the exercises is essential not only for halting but for also reversing the sarcopenia which is seen in COPD and severe asthma patients. Regular exercise enhances the muscle strength and endurance while countering the deconditioning. And it's important to understand this. Regular exercise not only enhances the strength of the muscles and the endurance of the muscles, but also it reduces the deconditioning of the muscles. And the supplements which we take, like magnesium, vitamin D and CA-HMB, they help mitigate the inflammation, the hypoxia-induced and the corticosteroid-induced muscle loss, thereby improving overall functional capacity and quality of life. So in summary, integrating a precise diagnosis, precise targeted nutritional supplementation, and a structured exercise program. All these three are important pillars and they are of paramount importance for reversing the sarcopenia and enhancing the functional outcomes in both COPD and severe asthma patients. Thank you so much.